Everyone has been admitted at this time. There's no list in the queue.
Okay, recording is started. Good evening, everyone. Thank you for taking the time to join NSBE HISIG and J&J Surgical Vision on this convention higher information webinar. My name is Dogo Abakusin, and I serve as the programs chair for the Healthcare Innovation Special Interest Group. And essentially in this role, I'm responsible for the development of programs, such as the one that we're having tonight, and essentially working with the rest of the team to deliver on events between HISIG and our partners. I have both my bachelor's and master's in biomedical engineering, and professionally, I work at the Mount Sinai Hospital where I I develop research software and also data engineering to assist the team in providing treatments for patients with neuropsychiatric disorders like depression, OCD, Parkinson's, and the like. So in tonight's event, you will learn all about Johnson & Johnson Surgical Vision, their innovative work, the awesome team behind that work, and the various opportunities that they have available at Johnson & Johnson Surgical Vision. So before we jump right into it, I'm going to go over a few housekeeping rules with you all. First, we ask that you mute your audio and turn off video. So actually, it's automatically applied as if you're not on the panel. So that's not a concern right now. But when we do get to the point of Q&A, you may have the opportunity to speak or enable your video. So we just ask that you be patient and wait so you get to that point in the event. Second, we ask that you use the chat feature. I believe that should be already enabled. And you can use that to post your questions, and members from our team will keep an eye out for these questions in order to capture that, and our moderator, Dr. Gray, will be able to post those questions during the Q&A session, or read them aloud during the Q&A session. So third, during the Q&A, we also ask that you wait to speak and share your video at that time. Lastly, we ask that you just be attentive, hear what everyone has to say, have your questions ready, and most importantly, just enjoy this meeting. So to just quickly review the agenda for tonight, we'll start with just some quick overview of HISIG. Many of you may already be familiar with HISIG, but we'll kind of do a recap of that for people who are already aware of HISIG or new people that are joining this call. And then I would turn it over to the J&J team to share an introduction and overview of J&J Surgical Vision. Subsequently, the team at J&J will discuss and share all the engineering roles that are available, which you guys should have already gotten links to, prior to this webinar, and hopefully you have some questions about that and are very interested in it. And then we will hear from members of J&J team about their career journey. And lastly, we'll open it up to the panel, which will be moderated by Dr. Gray. And now our Director Emeritus, John Thomas, will go over HISIG. Go over HISIG.
Thank you, Dolu. As he mentioned, my name is John Thomas. I'm the founding director of NSBE's Healthcare Innovation Team. Similar to Dolu, I am a mechanical materials engineer by undergrad training and a biomedical engineer by advanced degree. And the Healthcare Innovation Team started in 2016 with 3 engineers, one from J&J and another from Villanova University, Dr. David Jameson, and has grown into a 12 engineer team in the year of 2022. The Healthcare Innovation Team, team is affectionately named HISIG for short. really standing for the Healthcare Innovation Special Interest Group. The group is driven by our mission and vision, where our mission is to promote the development and implementation of healthcare innovations that will improve the diagnosis, treatment, and prevention of injury, illness, and disease. And our vision is really to be the most trusted ecosystem for technical expertise and solutions to complex healthcare problems impacting the Black and Brown community. HISIG realizes our mission through the CARE strategy, and CARE is an acronym for really the how that enables us to achieve the what, which is our mission. C, it really serves to align with connecting members interested in healthcare innovation with professionals in academia, government, industry, for mentorship, professional development, and career opportunities. The A in our CARE strategy aligns with advancing healthcare innovations through research, development, and commercialization. The R speaks to our abilities to support the recruitment and retainment of NSBE engineering professionals and members interested in healthcare innovation. The E speaks to our efforts to educate and expose the members of the HISIG community, as well as the NSBE professional, to healthcare disparities, innovations, and careers. And as you understand, the HISIG team and its membership has really experienced exponential growth in our 6 years within the society. Now, HISIG has a domestic presence with what you're seeing here by way of the stars, really an effort to establish HISIG footprints by way of our ecosystem build within the respective healthcare hotbeds and biomedical engineering states, where we have aligned with strategic partnerships with NSBE professional chapters and collegiate chapters to expand our reach and really support our efforts in building the community and connecting all engineers who have interested in healthcare innovation. And so across the NSBE map, we have presence right from region 1 all the way through region 6. While this image speaks to HISIG's national presence, we also have the society is a global society with chapters in Africa, specifically in Nigeria and Ghana, as well as the British West Indies and the Caribbean chapters in St. Lucia, Trinidad, and Jamaica. And conversations are currently underway with to build out chapters in England, Ireland, and Scotland of the UK. Back to you, Dolu.
Thank you, John. So I'll be speaking to HISIG signature programs. These are 6 among others. And essentially, these are 6 key programmatic efforts that are essentially coordinated across NSBE's 6 regions, right? So this includes the design challenge, where we host like an innovation challenge where diverse teams tackle healthcare disparities. Then we have, university, government, and industry tours where we expose members to different opportunities in the university, in academia and in industry. And then we have webinars like the one we're having today, where we introduce members to, companies that are in the healthcare space or innovating in the healthcare space. Our network mixer are essentially like in-person meetings to engage our members. Innovation panel, where we bring the brightest minds and subject matter experts together to plan and strategize around, how to innovate in the healthcare space. And our Nimble Experience program, which essentially is a 1-week internship program, introducing students from HBCUs to the biopharmaceutical industry. So, these are some of our signature programs, and to learn more about that, feel free to, check, go to the nsbe.org/HISIG website. I'd also like to highlight that at the convention in Anaheim next month, essentially, we've been approved for these 4 events, the healthcare luncheon, right? That's going to be on Friday. And then the university tour, approved to that, the network mixer and the town hall. So it's actually, we call this event pre-convention primer. And the reason for that is because, this is not just your only opportunity to interact with, teams from Johnson & Johnson. We also will be having a shared event by the way of the networking mixer. So if you're going to convention, we ask that you keep an eye out for that, and connect with the team also at convention. And everything that that's gone into planning this webinar, and essentially the emails that you guys get from us is organized and coordinated by this wonderful team of superstars. So this is the entire team. Yeah, so and we're always looking for more people to join the team. So feel free to send us an email or connect with us on LinkedIn. And I believe we'll be able to drop into the chat this URL to connect with LinkedIn. But if you have a chance, you can also scan this QR code to also connect with us on LinkedIn. Okay, with that, without further ado, I will turn it over to Ms. Janae Ferrer, who's the Director of Global R&D, Project Management Office at Johnson & Johnson Surgical Division. I'm excited to hear about this. So yeah, thank you.
Thank you very much, Adolu and John and the HISIG team. We're so excited to be with you this evening and delighted that you made the decision to join us and learn more about Johnson & Johnson Surgical Vision and the opportunities that we have available for you. So as Dolu mentioned, I'm a mechanical engineer and director of R&D project management, responsible for the global teams that develop and bring our new products to market. I've been with Johnson & Johnson for just over 13 years and in the medical device industry for more than 30 years now. I'm located in Southern California, and we have a whole panel of guests here with Johnson & Johnson. I'd like to start by sharing with you a short video that describes our Technis brand of intraocular lenses for cataract surgery. And it highlights one of our facilities in Groningen, the Netherlands. And you'll see in that video some members of our R&D team that work with our cross-functional teams globally, right here in Northern and Southern California. And right after the video, my boss, MK Rahija, who's the head of our global R&D organization, will share with you a short overview of Surgical Vision, the products and customers we serve. And following MK, Toby Island is on the line, our Senior Director of Laser and Software Systems, located in Milpitas, Northern California. And he'll describe to you our LASIK business and the open positions that we have available in that area. And following Toby, Bart Johnson, who's also on the line, our Senior Director of Ophthalmic Instrumentation Platforms, also located in Southern California, will describe our cataract business and the positions that we have available there. And then right after Bart, we have one of our star early in career engineers, Aaron Quinn, on the line to share with you his career journey and what he thinks about J&J. And by the way, Aaron is also an NSBE member. And then I'm bringing up the rear, Janae Farrar sharing as from a more seasoned in career approach, sharing with you my career journey. And we'll end with a panel discussion. We'll all stay around and have plenty of opportunity for you to ask questions about the positions we have or the company we're from. Happy to answer any questions you may have. So unless there are any questions in the chat, and I don't see any, we'll get started with a video, very short video.
The story of Technis is a story of extraordinary breakthrough innovation. Innovation is our story. But where does that story start?
We did a very large-scale study across Europe within many centers. We were working on a project that actually eventually became Technis. What's special about the aspheric surface of the Technis lens is that it's designed to correct the aberrations of the eye, similar to what happens in your eye when you're younger and when you have a higher quality of vision.
But the innovations were not to stop there.
Extended depth of focus was a game changer. The needs of patients have evolved, and we were able to adapt to that.
We have incorporated an extended depth of focus in some of our lenses. It provides you with high contrast, very good distance vision, very good intermediate vision, and very useful near vision as well.
With having Technis Toric 2, we are opening up the possibility of having astigmatism correction to many more patients.
We made it squared edge and frosted so that you maximize the friction between the haptics and the capsular bag. It's a result of trying to improve our lenses all the time.
Building from the strengths of a proven platform, in the hands of a dedicated global team, Technis always has been, and always will be, designed to deliver more.
The way I would encourage our employees to inspire one another as we look together toward the future is just to be so proud and confident of what we have built thus far and know that gives us a platform to stand upon to reach even greater heights.
So, where does our story start? Is it 20 years ago with a brilliant breakthrough invention? Or does it start in the lives, needs, and passions of the people we serve? A story that starts anew for all of us working with Technis, all around the world, every day.
I think the future of Technis is incredibly bright. We've had such success in treating so many patients and changing so many lives with Technis, but the best is in front of us.
When you look back with pride, you see one story. When you look forward with commitment, you see another. But it is only when you look at both that you see more.
All right. Hopefully you had a chance to appreciate the video that we showed you. It's a small lens that goes in your eyes. It's just a few milligrams and a very small lens, which replaces the natural lens in the eye during cataract surgery. I'm sure many of your parents or grandparents have gone through that surgery, and it stays in their eyes anywhere from 30 to 50 years because some of the children develop cataract also, and all through their lifetime, 70, 80 years, it stays in. So we designed the product that can stay in the eye for very long time, ranging from a few milligrams, as I said, in the lens, to the laser machine that you saw, which is a few £100 a laser machine. So that's the sort of a scope of products that we cover. But let's look at the scope of our life. And really, we are here to support the eye health at every stages of your life. For some of you who remember the children, your brothers and sisters, when they were little, or even when you were little and you were about 6-year-old, 7-year-old, you went to the doctor's office and doctor said, oh, you need glasses because you're, excuse me, because you're developing this nearsightedness. And as you went through your early years into the teenage years, your prescription kept going up, myopia. And I'm sure your parents and you're freaking out saying that, but he was only -1 last time and we went for the exam. Now he's 1.5 or 2 or 2.5. So myopia really progresses as we get older. So clearly we provide the solutions which take care of myopia. And as you become older and you're in your teenage years or in 20s and 30s, and sometimes you want to beautify your eyes, that we also sell lenses which improve the beauty of the eyes. And as we continue to get older, slowly our eyes start not being able to see near objects. And we move into the world of presbyopia. And all through this time, our eyes sometimes become dry. And we develop dry eyes. And we develop products to take care of the dry eyes. And glaucoma. So again, another disease of the eye is that the pressure in the eye increases, and that increase can cause blindness if not treated. So we have products which help reduce the pressure in the eye. It continues on as we get older into a higher degree of presbyopia. That means you can't see distance well, you can't see near well, and you need lenses to take care of all of that. And ultimately to a stage, as I said, your parents and grandparents, that the natural lens of the eye just gives up and you replace that, and that's cataract surgery. So all through the life from a child who's 5-year-old to somebody who's much older, into the 60s and 70s, we have products which take care of the vision. Now, why do we care about vision? Vision really is eyes are our windows to the world. 80% of what we learn is through the eyes. So as you joke with the people saying that sometimes we worry more about our 32 teeth than our eyes, and don't go for regular exams or take care of our eyes. But try closing your eyes for 2 hours and see how you feel, how different the world looks. And that's why we are all passionate about improving your vision, everyone's vision. Let's go to the next page. So let's step back. Clearly, vision is about $5 billion business for Johnson & Johnson. It's a pretty good sized business. But Johnson & Johnson is almost $100 billion revenue company, which plays in various segments. And as the motto here says, we blend heart, science, and ingenuity to profoundly change the trajectory of the health of humanity. So it's not just doing one little treatment, but really we want to change. We as human treat our health and how we improve our health, how we take care of ourselves. 135 years, 130,000 employees, live by our credo. For some of you, as you get older and you go into the management classes, you will hear about J&J Credo. It's a document that J&J created 75 years ago, which really sets in perspective what our focus should be, what our guiding light should be. And it has 4 paragraphs, and the first and foremost of our patients. Patients as well as surgeons, nurses, mothers, doctors, people who use our products. And second is our employees who create these products, who deliver this healthcare innovation. And number 3 is the communities that we live in. So clearly we want to take care of our patients, our employees, and our communities. And if we do these 3 right, the profits will come. So number 4 is shareholders. You would think as a young person looking and saying that this corporate world is worried more about making money, but no, clearly money is number 4. We have to first take care of, make sure we provide them the best health, take care of our employees, be responsible to the communities that we live in. And if we do those right, we'll make good money, we'll do well. As I said, our revenues this year is going to hit $100 billion, literally the number 1 healthcare company in the world. Next slide. And the slide captures the vision. In a typical year, the division that we are Vision, which is about $5 billion in revenue, touches the lives of 16 million people around the world. We have over 10,000 employees in over 100 countries, dozens of locations for manufacturing and R&D. We are there taking care of our patients, whether you are in Africa, whether you're in Australia, whether you're in India, China, or America. We have our offices, we have products and innovation that improve the sight of the people. Next slide. So when you look at some of the broad category of product that this division that you're speaking to, again, vision, we'll look at the consumer eye health product. So when you're using the contact lenses, so those solutions that you use, which take care of contact lenses, dry eye, if your eyes get dry, those products, vision correction, contact lenses, LASIK. You'll hear a lot more about LASIK from Toby. And you're at an age where I would strongly recommend to you, if you wear glasses, you should consider LASIK. And I don't just say that, I practice it. When my daughter turned 21, her 21st birthday gift was LASIK, because I think now she can enjoy for the next 20, 25, 30 years of great vision before presbyopia starts bothering her. So LASIK is a fantastic option. Contact lenses are a fantastic option. So either one of them, whatever suits you. And then cataract, finally, to take care of the people when their lenses really get spoiled. As we really get older and the lenses are opaque, then you want to remove the lens and insert this new lens in there. Next slide. And these are some of the examples of the brands. Perhaps one of the most common one that you may know is AccuView. AccuView contact lenses. It's billions of dollars in revenue. And just like J&J is well known for its brand power on various products, AccuView is very well known in the world of eye. If you ever went to the office of any eye doctor, if you looked at their shelf, you will find some AccuView product. You will find some collateral which speaks to AccuView. So AccuView is one of our biggest brand. Technis, you saw the beautiful video, how we transformed the people's life through innovation. Our innovation center that I highlighted was in Europe. And the refractive surgery, that research center is in Northern California. And Toby is the one who's in charge of that. And the cataract, as well as some of the ocular surfaces, is something that Bart will be speaking to you about. So moving right along. See, innovation continues, right? The easiest example I can give you is that when iPhone launches iPhone 13, the researchers don't say, you know what, I think 13 is a great product. Let's launch next product 5 or 10 years from now. Same applies for us. The one on the left, as you can see, we launched several new products, new lenses, new machines due to the cataract surgery and the LASIK surgery. But at the same time, we have next generation products that we're pushing pretty hard. We have hundreds of employees in Northern and Southern California, in Sweden, in Netherlands, and our vision contact lens team in Jacksonville, which is doing research in all these spaces. And Toby and Bart will speak a little more to some of the typical roles that you see at our company. And we got some advanced question from the HISIG leadership, and I'll be happy to answer some of your questions later on. So Toby, I'll pass it on to you. Toby, unmute.
Thank you, MK. Good evening, everyone. Happy to be with you. I'm Toby Island. I lead the R&D for the laser platforms and software for Johnson & Johnson Surgical Vision. I'm relatively new to J&J. Actually been here about 1.5 years myself, but I've worked in medical lasers for about 25 years now in my career. We wanted to start off here, just as MK says, talking about refractive surgery. So this is an example of our laser products. So we've been a pioneer in LASIK. Our team was actually the inventor of this technology about 25 years ago. So I also practice what I preach here. I had LASIK myself about 15 years ago. Been very happy with it. So what we do in this case is we correct the vision by forming a flap on the eye that you fold away, and then you ablate the surface of the cornea with an excimer laser very precisely to give an exact surgical correction, the proper shape to do the refraction that you need. This has been a very successful, done in millions of patients over the years. And we're very actively working on future generations of this product. One of the things I also like to say about this is that, in a way, what we're developing here are really high precision robots right? Where we're delivering a laser beam or a laser spot to a very precise location to do these treatments. So there's a lot of interesting innovation that happens both on the sort of robotic space as well as the optics and laser spaces. And I'll talk in a moment about the software side as well. And then we also have similar other laser products that do corneal surgeries for cataract surgery and other indications. Next slide, please. So I wanted to talk for a moment about the positions we have available in our group. These are all, the ones we show here are all related to software. And so software is a very exciting innovation space for us. So as I said, in the machine control aspects, the software drives these machines for us. So very important algorithms and driving the laser spot positioning, motion control aspects and the like. And then we also have a very exciting initiative around what we call the connected operating room or the connected practice. And this is digital product solutions driven by software that improve outcomes and improve workflows for our surgeons. What's really important and exciting about this is what this is connecting all of our surgery equipment together so that we share data across the different devices that we have. We allow offline treatment planning. We allow connection to diagnostic devices, and we actually completely close the loop between an initial diagnosis that someone has through treatment to a final outcome, and then allow sort of improvement based on that closed loop. So we have open here in either Milpitas, California area or in Southern California in the Irvine area, a staff software application engineer. These work on off-device applications that allow surgery centers to do their treatment planning, smart application of artificial intelligence techniques, that type of work. We also have Internet of Things or IoT software development. So all of our devices are being connected up to a J&J secure cloud that we share the data. The key part of this is really this IoT services. We also have cybersecurity and product security position open. So cybersecurity is an ever increasing important aspect in all of our products, and as we connect them together even more. And then finally, we have a role of a director of software R&D that will oversee the entire teams here of about 25 people that we have full-time employees, as well as many partners and vendors that we work with as well. So if you're interested in these roles, at the bottom of this slide is the contact information. Please contact us, and we'd love to talk with you. And then before I sign off, I just want to say one other thing too, which is these are the roles we have currently available. But as you see from our products, we have large teams here working across physics, optics, lasers, electrical engineering, mechanical engineering as well. So if you also have those kind of broad interests, also please feel free to reach out to us. Thank you.
All right.
I'll turn this
Thank
over
you,
to
Toby.
turn it over to Bart Johnson.
Thank you, Toby. Thank you, Janae. Yes, my pleasure also to be with you this evening. So thank you for the opportunity to talk a little bit about what we do, our passion for it, and some of the opportunities we have. So cataracts is a big part of our business, and if you're not familiar with cataracts, it's actually it's the most common surgical procedure in the world. And a cataract basically is the clouding of the lens in your eye that's inside your eye. It's called a crystalline lens. And that lens is really important. It's what continuously adapts to different focal lengths to help you see at all different distances. So it's why you can see like really close up or really far away, and your eye is constantly dynamically adapting. As we get older, you start to lose that adaptation, and that's called presbyopia. So you start to need reading glasses, you start to have trouble seeing close up. But as you know, if we're lucky enough and we live long enough, the proteins in your eye start to aggregate and they cloud and that clouding is what cataract is. And if it goes on long enough, it gets harder and harder, and it becomes so dense that light even can't get through it. It starts by scattering, so it kind of makes your vision foggy, but eventually it becomes impenetrable to light, and it'll cause total blindness. So cataracts are the #1 cause of preventable blindness in the world. And if you can see on the slide, it affects 20 million people. So everybody needs the procedure eventually. And so it's one of the things that we're really, passionate about, being engaged in the science of cataracts and then how to do the surgery well. So I saw actually a question in the chat about how you measure the effectiveness of LASIK, and that's a great question, and it's a great question for all surgical procedures, because as MK talked a little bit about, like, our credo, which is our core values, but the #1 thing is all about the patient, and so the effectiveness of all surgery is first and foremost measured by outcomes, is what we call it, and that's how effective it is. The procedure is at treating the patient and solving the problem that they had. So in the case of vision, the most common outcome is measuring vision before and then after. So that's a really important thing. And then we also focus on safety. That's a really important measure of any procedure. And so we are continuously trying to improve the safety of the procedures as well. A third one is efficiency, because cataract surgery is so prevalent, and there really are getting to be more patients than surgeons. The efficiency and the ability to do the procedure quickly is actually really important as well. And it's a pretty fast procedure. It's 15 minutes or less, sometimes much less, depending on the surgical center. So part of the process is getting the cataract out of the eye, and then enables putting this tiny little lens that you see a picture of on the slide. That's about 12 or 13 millimeters total, which is pretty small, into the eye. And that's done through a micro incision of about 2 millimeters. You want to minimize the size of that incision because it helps with the healing process, and that goes back to the outcomes. So you don't want to have the cornea be deformed by the healing process, because that makes it very unpredictable what your vision will be. So the procedure has evolved to where you have this tiny little incision, and then you have to get this really large cataract out through the incision and then put this lens in through the incision. So a part of what we do is what's called phacoemulsification, and that machine you see in the bottom of the slide is a machine that provides ultrasonic energy and then fluid into the eye, and that helps break up the cataract and pull it out through a needle through this tiny incision. And this is where a lot of the innovation is focused in making that equipment and that technology better and better. So we're doing a lot of work in the area. Similar with the analogy we use a lot is like self-driving cars, and cars get more and more sensors, and they get more and more intelligent. It's similar in surgical equipment. Like Toby mentioned, robotics. I mean, in a way, almost everything is becoming more robotic-like. So that's a big area of focus. And the optics of the lenses as well is super critical, and that's one we really have the leading best optics in the world, and that's one of the things we're very, very proud of. And not just resting on the performance of today's lenses, but it's just wave after wave of better and better innovation in optics, again driving for those better and better outcomes. So yeah, if we want to just touch quickly on positions, so a lot of opportunities especially in the electrical engineering space. The work that we do is very intensive in terms of circuit design, sensors, designing of integrating computer systems with electronic systems, and so we have several roles in Southern California and Northern California at all different levels. So if you have electrical engineering background, we definitely would love to connect and learn more about you and explore mutual opportunities. So yeah, you can see all those through the links provided, and please take a look and explore. We also have one mechanical engineering role as well. And so we have a great and growing group of both electrical and mechanical engineers. So as Toby mentioned, these are the opportunities that are available right now, but it's constantly evolving. So please, if there's not something that's a good fit right now, please please check back too. So I think that's it. And thank you very much.
Thank you very much, Bart. And once again, here's the contact information for you can send your resume and which position you're interested in this week, and we will connect with you. Aaron?
All right. Hi, everyone. My name is Aaron Quinn, as Janae mentioned. I went to Cal Poly San Luis Obispo studying biomedical engineering. During the time, I was also involved in NSBE, so I was a Region 6 alumni. Before joining J&J, I was also working in the contract manufacturing industry, building catheters and bioelectronics, so gave me a lot of valuable experience. So kind of starting in my career path here at J&J, starting as an R&D engineer. I was pretty new to the team, so with our team, we build a accessory to our laser system. I work with Toby and his larger team. Starting out, I was shadowing a lot of development and verification of shelf life testing with our team. So learning the ins and outs of our device was a large part of my early time here at J&J. Moving on, I was able to connect with my mentor, Tim Williams, who's a part of the regulatory team. So kind of gaining on his experience, I was able to get a lot of insights on navigating the corporate world and making connections in that space. So it's very valuable. Moving on, I was able to provide some of my insights on training through medical devices through my early on shadowing experience to teams in order for them to develop their own testing. So I was able to basically lend my helping hand there. And so it's a good experience. Moving on, gaining the title of a project lead for surgical development of a tool, I was able to working with a larger R&D team and the clinical team to help develop surgical equipment for our surgical devices. J&J also offers a lot of career development opportunities, so I was able to take advantage of a project management course early on. Gave me insights on planning and project management skills. Excuse me. And also J&J is very involved in the community. So Janae and I were able to partner in a few events through BTE, which is a STEM workshop. I was able to present some of my experiences here at J&J and also plan a few workshops with her as well. So it was a great experience there. Moving on, I was able to discuss career objectives with my manager, which is really important just so that I'm aware of where I want to go, and also that my manager is also aware of where I want to go in the future with my career. One of my goals was to start my Six Sigma Black Belt training, which I did and completed. So I'm currently waiting to take my certification for that once my project is completed. So that'll be a good goal for my personal development. And moving along, I'm currently supporting the development of the next generation of our surgical accessories. So being able to get good insights on clinical research and R&D development and getting firsthand experience talking to doctors in the clinical studies. And basically a future goal of mine is an engineering leadership role within J&J and just to continue developing my skills within the company. So that's pretty much my career path there, and any questions at the end, I'll be happy to answer.
Thank you so much, Aaron, one of our star engineers, as I mentioned. And now just to talk about a little more of a seasoned engineer myself, I'm, as I mentioned, a mechanical engineer, grew up in Detroit, Michigan, right in the inner city, learned through the auto industry about engineering, and someone, I think in 8th grade, told me the best engineers go to MIT, so that's where I want to go, and set my sights on it, and found myself there, and graduated back in the late 80s in mechanical engineering, and then went on to Stanford University for a master's degree in manufacturing systems engineering. Always had an interest in operations and production and design for manufacturability. And that's what I did for nearly 18 years at 3M Company in Southern California and also in Minnesota, where their headquarters. had quite a career in operations and manufacturing, production, general supervision, engineering supervision in orthodontic products, medical devices, and got some experience too. My first experience in R&D leading commercialization teams. And then 3M had a big effort in Six Sigma, and I joined that just like Aaron mentioned and became a Six Sigma black belt. And that was a wonderful opportunity to learn how to use some of the analytical skills in engineering and manufacturing and take that onto the business side, actually all across the company, process improvement through a discipline strategy for making a difference all across the company. And it was through that experience that I learned how much I loved project management, and then worked with the Project Management Institute to become a professional project manager. And that began my career with Johnson & Johnson more than 13 years ago, still in Southern California as a director of R&D project management. And I moved on to Abbott Labs doing the same type of work. And lo and behold, a few years later, J&J, or AMO at the time, was acquired by Abbott. And again, I was part of J&J. And I think I said that wrong. J&J acquired Abbott, and so I became a part of J&J again. And we fortunately were able to keep all of our seniority. So here I am still with Johnson & Johnson for more than 13 years. So it's been a fantastic experience. And the last thing I wanted to mention is something that Aaron brought up. J&J for me isn't about just the engineering or the STEM type of opportunities. That's a big part of it because it's a great team that we have. But another part of it is what MK alluded to at the beginning, what the Credo instructs us or gives us the opportunity to do is bring all of ourselves, all of our passions for the community, for STEM, as Aaron mentioned, for young people. We adopted a local high school through the Bridge to Employment program where we had fun last month, Aaron and I, showing the young people how to build robots and race robots and introduce them to careers in STEM. And so lots of community activities that J&J sponsors and gives us the opportunity to participate in. Also creating great environment for our employees, that second tenet of the Credo. My passion is talent development. And so one of the areas that I had a chance to do was do seminars all across the company on how to create a life and career that you love. And my boss gave me the opportunity, as long as I got the rest of my work done, to provide that, share that passion with different employees because they were interested too. So that's one of the things that we really enjoy about J&J. It helps give you the opportunity to bring your whole self to work. And that's what we hope to be able to share with you if you're interested in some of the opportunities we have. So now I saw there were some questions in the chat, and I think Dr. Gray, you want to open it up for the panel discussion? Maybe we can address some of those questions.
Absolutely. Thanks all of you for a wonderful overview, really, of what your organization does and the products that they offer. And I'm personally intrigued. My father was an optician. So everything you're talking about, I never thought as an engineer I'd be able to be a part of. With that said, the questions and topics are arising, and I see within the chat some of them are being addressed. So I want to see if there were any questions that are relative or relevant to any of the positions that have not been answered. I don't see any in there. Thanks, Bart, for answering, it looks like Tony's question. And we'll start off with just an open-ended question about the different types of roles, technical roles that are most common within your industry. And you spoke a little bit about it within the different positions, but there's the opportunity to elaborate on any other areas or common technical roles within your industry that may not have been touched on.
Actually, let me start by actually one question is there in the chat that we missed. If you don't mind, let me just hit that.
Absolutely, go for it.
Because I think the question here is that are there positions available internationally? And can you travel and work? Absolutely. I mentioned to you that we have 2 R&D centers, one in Sweden, one in Netherlands, and 3 in US, Northern, Southern California, and Florida. So definitely, and we are looking for engineers there also right now. For example, we're looking in Netherlands running in facilities and process engineers. So we are absolutely open to any of you thinking of doing an international stint for a year or two as you're early in your career and want to spend some time. And these are wonderful locations, both Uppsala and Groningen are, you can say, university towns. When Groningen is busy, it has like 40,000 students. So it's a great place to be, as long as you can handle the code a little bit. And so we certainly have it, but there is one more dimension that I just want to bring to you. Clearly, this discussion is with the R&D staff that you're having, but engineers don't just do R&D. Engineers are also in clinical, engineers are also in regulatory affairs, engineers are also in business. Just to give you an example, our vice president of marketing, she's an engineer. So she was originally an engineer and then she decided to take her career to the management and MBA and commercial assignment. So when you're coming into a large company like J&J, it's giving you many, many degrees of freedom. One obviously is taking engineering role, take your passion of innovating and creating new product. Absolutely fantastic. We all love that, as you can hear from our voices with it on why we do what we do. But then many want to go and expand their horizon and go into perhaps different area. They've been in the vision for a couple of years. They want to go into cardiology. They want to go into orthopedics, any of the other areas. Or they say, you know what, I like this, but I want to do project management, or I want to be in marketing. Wouldn't it be nice to be in the marketing group and do MBA? And so we certainly help you go to the what's called graduate school if you want to pay for some of your tuition. The J&J policy is just fantastic in that space to help you grow your career in many different ways. And many of the companies that I worked, as a matter of fact, chairman of our business, the $10 billion business, he's the technical person himself. He started from R&D. So you can go all the way up to the chairman of the company, you know. So the path is just unlimited. And engineering is just making you a solid professional, solid individual who's helped you understand the problem in front of you and how to be the patient customer needs and build your career over that.
Thank you. A great question, Brianna. I appreciate you addressing that and bringing it to my attention. That's a fantastic question. And a related question that I see here are hiring policies for international students that are really interested in R&D mechanical engineering positions.
The chemical engineering, chemistry-oriented positions are in Florida, actually, for us. And we do have positions absolutely in Florida. But internationally, no, I don't think so. We may have some in Uppsala because we do some of the viscoelastic liquids. And yes, it does require some chemical engineering element. So yes, we do have chemical engineering in these 2 locations for this division. But clearly, if you went to J&J Pharma, there's all kinds of chemical engineering roles all over the world, you know.
And to clarify, it's mechanical engineering that they are interested in. Mm-hmm.
Yeah, I think the question is about maybe not working internationally, but for international students.
Yep.
To work in the U.S., which, you know, we definitely were interested in, you know, seeing any candidates, but you know, visas are always a conversation, and that can be, you know, there can be challenges sometimes, but we're always open to at least, evaluating the potential. So.
Yeah, but it's a good point. It's Clive here, and I'll just add to that. We're open to everybody applying. Doesn't matter what part of the world they're in. The reality that we're faced with, especially with COVID-19, is and slowdown in visa processing times in the United States for internationals is it's a little longer. By little, I mean somewhere between 3 to 9 months to get international visas for international people. And by the way, that's not just for people coming from outside of J&J, but even when we're moving people to the US from J&J locations in other parts of the world, we're realizing the backlog there. So we're open, but we are kind of hamstrung a little bit in time.
I'll just add to just the subject of international. We have sites internationally, research innovation centers, but generally we're a very international company from the standpoint of all our products are global. So our products are designed for many countries around the world. So that's an opportunity. If your interest is in getting exposure internationally, that's an opportunity from a customer perspective and a market perspective. And also we partner with international suppliers all over the world, Europe and Asia and just everywhere. So there's all kinds of opportunities to work with people in other parts of the world, and that can create travel opportunities, et cetera. So it's a very rich environment from that standpoint.
Great answers to those questions. I appreciate that insight. Are there other questions? Oh, go ahead.
Well, Dr. Gray, I thought I could also answer your question about other role types that we have. Just to build a little bit on what MK said too, I think one of the things that I found so interesting about J&J in joining the company recently was, and just looking at our teams, it's really end-to-end innovation, right? So we've got people working on the very front end at the conception of these product ideas, very early stage research, through product development in all of its stages, and then, into the clinic and the like. And so there are a lot of opportunities along that for, cross-functional collaboration and working with colleagues in the clinical field, in the regulatory field, in operations and supply chain. And just to mention a couple others then that we have is, optical engineering, systems engineering is a very important field for us. We have physicists, we have medical doctors, very important parts of our teams here. Too, we have tissue scientists, so things in biomedical engineering that are looking at the effects of, light, for example, on tissue or other kind of energies on tissue. So there's quite a long range of various engineering fields available.
Hey, Toby, there's a question for you here on the systems engineering.
Yes.
Is that?
No, yeah, and it's one, as a systems engineer, my PhD is actually in systems engineering, not an MD. So I'm glad that George asked the question of how important is systems engineering in healthcare.
Yeah, so I'll address that from my perspective. Very is the short answer. So it's really critical to us when, as part of the product development. So for example, a kind of a V model, which is sort of traditional in systems engineering, where we're carefully identifying our needs and our requirements and sort of driving that through the product design phase, and then on the sort of backside of that, right, checking that all of our testing. We had a question earlier about how do we verify, performance and the like, and then really building. So I think that aspect is very important in all the products. We're adding people to that team and strengthening that. We see that's important to moving innovation from a research phase, into products where you can really benefit benefit our patient here. So yeah, we're adding to that all the time.
That is fantastic. It's wonderful to hear. That's because from my research in I'll say patient safety and care quality, having a systems engineering component or dynamic perspective is extremely valuable. Along those lines, one of the questions that I think have been brewing based on some of, and I see we have other questions coming in at the same time that I want to address, and then I can address the other one that I had earlier. So someone saying that they found R&D mechanical engineering position that is not available on the website. How can I apply to this position? And I've already emailed Nabila.
Yeah, if Nabila can share, well, through Janae, we'll get the resume, and I'll make sure that that gets considered and put in the queue, and we'll make sure that that posting gets put back up soon.
Okay, fantastic.
Right.
And
So in any of the ones that we shared with you today, if you could, you don't even need to worry yet about applying to the different positions. If you just let us know which area you're interested in, which of the postings you saw, and send us your resume, we can do some pre-screening and direct you to the proper job to apply for.
Hey, Janae, maybe we should share with them. What's the job site? jobs.jnj.com. Which one is that, right?
Yes, yes, you got
So
it.
if you go to jobs.jnj.com, you can sort through all kinds of location, through engineering discipline. You can, because there are hundreds, if not thousand jobs on that website, I bet, across the entire JNJ. You can literally pick what area you want to look into, whether you're focused on, hey, you want to be in Massachusetts, or you want to be in California, you want to be in Netherlands. So just pick your thing and see, see if there's a role in that country or not, that you want to look at that. So there are many ways to slice and dice that.
I appreciate you bringing that up and the opportunity for us to address this question, because our intention within NSBE is to help facilitate these opportunity identifications, but not just the identification at the professionals level. You know, when you're looking for a specific area of expertise, that we can provide a handoff to Johnson & Johnson that really ideally would elevate the priority of the applicant or the candidate, as opposed to you guys going through tons and tons of resumes and emails and and the postings and things like that. So with that said, it looks like, John, I see your hand is up. Did you have a question you wanted to address?
Yeah, thank you, Dr. Gray. Appreciate the opportunity to submit a question that I think for the benefit of the engineers. Perhaps Janae, Dr. Raja, Dr. Island, or even Mr. Pinto could speak to the J&J interview process from a technical perspective, and then perhaps from an HR process perspective.
Clive, why don't you start first?
Sure. I'll talk a little bit about from a technical perspective is, you know, you submit the resume, and if you're selected for an interview, it's likely going to be with someone from our talent acquisition team. In some cases, it may not. You may go directly to the hiring manager. One of the things that we're trying to do is make sure we have multiple perspectives, diverse perspectives, interviewing our candidates to see different angles of what are the strengths of that candidacy. A lot of people you'll hear through interview process talk about fit. You know, do you fit this role? Do you fit this company? I try to educate managers that I'm working with. It's not about fit, it's about compatibility. Your strengths, your development areas, how are they compatible? Your character, your attitude, how is that compatible with being a Johnson & Johnson associate? And that's really what it's about. We don't have to be square peg and square hole, right? So think about what your interests are, what you want to do. And now moving from the technical to the how to prepare for these sorts of things is really identify with your purpose. What are your values, your core values? What's most important to you? What drives you? What inspires you? Do you see that in the job description? Do you see that in the company that you're interviewing for? And do you see that with our values? And do you see the blend there and reflected in what's important to you? And if you do that and you go through the interview process, don't just think, well, hopefully I'll be selected. Think about, am I seeing from these interviewers a connection in how they're going to help me grow my career? That's really important to us. It's not about what you can do for us. It's about what we can do for each other and what we can create together. So I'll pause there and hand to Janae or MK or the others for their thoughts.
Yes, one of the things that Clive mentioned is, and that's one of the things that attracted me to Johnson & Johnson. It wasn't just about the position that I applied for and received. It was about being able to, like Aaron said, explore, work with cross-functional teams in all different areas: regulatory, clinical, R&D, marketing. And as I discovered along the way my passions, I could even take a grow assignment, do my regular job, and spend a certain percentage of my time doing something that I thought was interesting as a development plan. Not only do we have objectives for our technical plan, but we have personal development plans where we can volunteer, explore other areas, and grow our career in a different direction if we choose to. So the company allows us to do that.
Thank you, Janae. That is a very, extremely valuable point, because we have a number of our members who have such a strong technical background. To have that opportunity to develop and expand is key. And along those lines, one of the other questions that come to mind, I was extremely impressed with your path into J&J from, excuse me, other industries. And we have a number of engineers who may have been trained in a certain industry and have a desire to transition into the healthcare industry. Any one suggestions on how one would go about doing that at the professional level versus entry level? And then two, in your experience and others, how J&J supports that transition?
Let me give a couple of angles into that, right? So first and foremost, I mean, we all go and get our education at the university, right? And maybe I do research or whatever area in one particular area, but it makes a good engineer, good scientist, good thinker out of us. And smart company knows how to get those smart people. I'll give you my own example, right? What I did my PhD thesis on, I don't think I ever used that. So I mean, maybe I used a little bit, okay. But point is the career goes all over the place. So I think, and unlike in the past, oh yeah, you can from the oil and gas industry. Oh no, you can't go to the automotive. That's not the case anymore. And because we're looking at people for their capability and their knowledge. So that's one. And there are two other, I'm a very pragmatic and transparent guy, so I'll give you two other angles here. Job market is really good right now. People are willing to stop and listen a little bit, saying that, okay, here's a great engineer. We've had actually, Toby and Bart have hired engineers who did not come from healthcare. And we're willing to take a chance. As a matter of Bart has a new engineering manager start who's never worked in healthcare industry just 2 weeks ago. But we went for him because he had perfect experience that we wanted. Yes, we can teach him some of the things that we need to learn, right? That's another thing in your favor as an engineer. Another one is you look at the progressive companies like J&J, right? Who's really committed to diversity and inclusion. So we made a stated goal. I think, I don't know if you heard it or not. We made the commitment to try to get to the 13, or you know what 13 is, right? 13% of the population is Black, but clearly corporate America does not look like 13, right? So we are consciously saying, hey, listen, we are committed to bringing that thing. I mean, I have hundreds of people in my R&D organization. Forget about 13%. I'll be happy if I can have 13 total number, you know. So So clearly there is a commitment to building the diversity and inclusion. There is commitment to bringing the best engineer. So there are so many dimensions which makes J&J very exciting for your membership team. And as a matter of fact, I hope many of you become ambassadors to your colleagues and to your friends and remind them what they missed in the call today and get them to apply here and get them to pay attention to what J&J is doing. It's a great career. It's a great company.
Let me just add two quick things, because I joined J&J with no healthcare experience, and part of how I did that was I had experience in Six Sigma, which Janae and Aaron both mentioned, and that was something that J&J was really looking for, and so that was kind of my in. I also had some regulated industry experience, which was helpful. But the real key here, which is I'll call this a bit of a secret. Maybe it's not a secret, and I hope I don't get in trouble with Clive for this. But I mean, there's two really simple criteria. There's required criteria and desired criteria when you're applying for a job, and typically like healthcare experience is a desired criteria, and all desired criteria are negotiable. So if you have like the talent, the passion, and you have these other like strong characteristics, the desired stuff, it can all be sort of worked through. So that's something to really keep in mind. So like, don't be afraid to apply for a position where there's all this stuff listed and you don't meet all that, because every job description kind of shows up that way, because a lot of that's probably just desired. So that would be the other tip.
You're not in trouble, Bart. I 100% agree with you. I think one thing we didn't talk about before is there is always an element of gray in the recruitment and selection process, right? We don't just look at a black and white resume and say yes, no. If we have an opportunity to get to know the candidate, we're going to do that, and we're going to see all the other things that you can't fit on one page, and then we're going to make an educated, informed decision.
Thank you for answering that. What I heard was you all are not hiring degrees, technical degrees, or certain industry experiences, but people who can be team players and really contribute to diversity. And what I also heard is when we talk about diversity, equity, and inclusion, it isn't just race and ethnicity. There's a diversity of backgrounds, diversity of engineers, diversity of technical degrees that can bring value to the table in an organization such as Johnson & Johnson. So thanks for sharing that perspective. Are there any other questions out there? Feel free to raise your hand. I can generate another question, but we'd love to hear from you guys more so. So don't be shy.
Great. You have a question from Rowan Yahia.
And I believe it may have been answered. Is that the one related to the background, it looks like, and a disadvantage? Yes, I believe that one was addressed. Does that suffice for your? It looks like she's satisfied with her response.
Really, I think the possibilities are tremendous. Engineering is a start, but you need to ask yourself what you want to do, where you want to take your career. We need curious people who truly believe in making the lives of other human beings better through the healthcare. And I think that's what J&J is driven by.
And that's a fantastic statement, and it's really to that point what it's going to take, a diversity of perspectives and innovative approaches, which is why within healthcare innovation, to really address many of the health disparities that are global, but really impact communities of color, which is one of the reasons why personally, as a Lean Six Sigma Black Belt and PMP, chose to focus in health systems for the PhD. But similar to you, I may or may not do work in the area of the doctorate. So once again, it's not about the degree, it's about the passion and the purpose that you feel led by or driven towards within a certain area.
So you know, you just trigger something in my mind. So you give example of healthcare disparity, right? So J&J is so progressive that we have our equivalent of SIG that you have, which is focused on how do you create better enrollment in diverse population in clinical trials. So we actually have a group within J&J which is focused on expanding the utilization of subjects of color in the clinical trial. So I think you can just think of an area of, and I'm sure in J&J you'll find somebody who's really passionate about it and really getting other people motivated to change.
No shortage of groups for you to get involved in.
Fantastic. One follow-up question that comes to mind, at least for me. Let me see. Looks like Tony may have another question before I get into mine. Are there any type of background, so security, privacy, encouraged to apply? I see how those backgrounds might apply to an R&D organization, just not sure if the positions are there. Okay. So
yeah, actually, Toby, you can answer on the cybersecurity piece because we're looking for those people. Yeah.
Yeah, I was going to talk about that. So we have a specific position open right now, even on cybersecurity, and it's very related to the protection of personal information, private healthcare information. So yes, very very much.
We actually have a position right now open.
Yeah. So please send us your information. That's one of the hot areas that we're interested in.
great question. And you wouldn't think of that when you think of, well, I personally wouldn't, J&J Vision to be in that space. So good question, Tony, and thanks for that insight panel.
Remember all these devices that you saw, laser and other cataract machines? They are connected devices and it's got patient information. So cybersecurity becomes a pretty important element of what Bart and Toby navigate through as they're developing machines.
Yeah,
Right.
I was just in a important hour-long cybersecurity meeting today, and it was, pretty daunting, the amount of increasing requirements, and we were really talking about how we need good people to work on the teams to help with those things. So it's a hot topic for sure.
Fantastic.
And patent, innovation and patents go together. You need to protect your innovation, right? So I think there's a question on IP here, of course. Our engineers, scientists, everyone is encouraged to file those invention disclosures and get those patents. And just like any other company, we are sometime in the middle of a lawsuit if somebody is infringing on our intellectual capital.
Great, great. Sounds like Tony could be a potential candidate for you guys.
Hey, engineers also go and become lawyers, okay? And they're the IP attorneys.
Fantastic, fantastic. A closing question before we remind our audience how they can stay engaged is relevant to kind of the support that you all have. Most organizations of your size these days have some sort of employee resource group to support diverse employees and things like that. And interested in if you can speak to, internally, what type of support for diverse candidates especially coming in at the professional level, you all could provide or are in the process of creating.
I think Janae and Clive, you guys do lots of SIGs,
There's literally hundreds of employee resource groups that you can get involved with. It's just dependent on who you feel you connect with, where your passions are. As we mentioned, Aaron and I are with the Bridge to Employment group, where we adopted a local high school just because we love sharing our STEM passions with students. They're African American employee resource groups. there are different initiatives that you can get involved with. I'm involved with one around university recruiting and professional recruiting. That's part of where I met Dr. Gray at one of our GEM conferences, Graduate Degrees for Minorities in Engineering. So it's just, the sky is the limit to what you can physically handle in terms of the time and effort, but it's amazing.
Thank
The only
you.
thing I'll add to that, well covered, Janae. The only thing I'll add is, if you are nominated for programs by managers to develop your career with J&J and leadership development programs or experiences, they might be short term. Janae mentioned the Grow assignment. There's a lot of support for diverse employees within the organization, and it's just getting stronger and stronger and more. So, we still have a long way to go, but we're making a lot of strides.
Sounds like you guys are truly advocates in applying continuous improvement. So that's fantastic. Fantastic. And it looks like go ahead. I saw one other question, but let's proceed.
Janae, you want to speak to the GEM and some of your university initiative? Because I think one of the questions actually addressed towards that, I think.
Oh, okay. What's the question, just to make sure I answer
it? You want to read it, Joshua?
Sure. Yeah, we have one other question that's in here on do you all do all the roles hire on a rolling basis? They're currently in a program and they're trying to figure out how they should apply to start applying for the roles.
For example, are you in a currently in a course and you're waiting to see complete that before you want to apply it? Is that what you're thinking? Then we certainly have internship programs, and I think, Janae, that's what I was wondering, if you want to mention the GEM, that we're getting quite a few interns actually through that.
Right. So there's a program, if you haven't heard about it, it's a fantastic program for minorities who are interested in moving on to graduate degrees, either master's or PhD in a STEM field. There's a great program called the GEM Consortium that you apply to, and then as long as you get accepted to one of their member universities, and all the top STEM schools are a part of GEM, you can also be matched with many companies like Johnson & Johnson, and not only will you get a full ride fellowship for your graduate studies, but you also included with that comes internships during the summers with companies like J&J. And we're up to 9 GEM fellows now across 3 divisions that we're going to have starting next summer. So I'm a GEM fellow from X number of years ago, and my husband's a GEM fellow. Our son is currently a fellow at Northwestern. Our daughter soon, hopefully in a couple years. So it's just a fantastic program, and we're one of the supporting employer members for that. And Joshua Gray, that's where we met at the GEM conference last year.
Absolutely. And it's I'm a GEM fellow as well, and I almost got sponsored through J&J. I won't say how many years either, Janae, but it's a fantastic program. And it looks like we got maybe one other. Can you kindly share the website? Yes, someone put it in there. And since you mentioned internship position, I want to ask, students who graduated can be hired as interns to kickstart their career.
Yes, send us that information, because we also have programs for people who have graduated and want to be involved in, for example, R&D rotational programs, where you can spend 6 months to a year in 2 or 3 different divisions across J&J to learn where you want to land eventually.
Good answers. And I see that we are coming up on our time. I just wanted to put in a plug for you all who are strongly considering our our conference that's coming up in Anaheim, which you can attend in person if you want. I did my PhD at the University of Southern California, so I'm excited about getting back to Southern California for the conference in the beautiful beaches, or you can participate virtually, such as this today. And we will have a mixer where you'll have the opportunity to connect and learn more about these positions and opportunities and speak with Janae, as I did when I initially met her. Wonderful person, extremely down to earth, and open to serving as really a facilitator of possibility if you're interested in exploring options and careers at Johnson & Johnson. So a reminder of that. Any closing comments that you all would like to make before we conclude?
I think I just want to say thank you for hosting this with us. And I hope the word gets out. The J&J is the place to be for the smart engineers. And we'll keep them happy and challenged when they come to us.
Great.
Thank you very much. Really appreciate your spending the time with us.
Absolutely. And if you have any other follow-up questions, feel free to email healthcare membership at nsbe.org, which is also who you would email with your resumes to apply for the various positions. So thanks once again to our wonderful panelists for your time, interest, and your responses and answers. Great insight that you all provided. I've learned a ton myself, and I'm sure that our participants have as well.
Thank you. Have a good evening.
Take care.
Thank you.
Bye-bye.
Thank you. Have a good evening.